Okay, aloha everyone, and thank you for joining our Regional Community Coalition call today. Can everybody hear me okay?
We can, thanks.
Great. Next slide, please, Mary. So a couple housekeeping items, please. We'd like you to mute your microphones during the presentation. Please feel free to chime in at any time if you have any questions. You can enter your questions into the chat box, and you can share your experiences here with the group. We will be doing some polling today, and we'll be looking to get a lot of you folks reactions and observations to some of the different work that we're doing. And we'll look forward to adding this to the work as we go forward and helping us direct that. Next slide, please. So please, for all you folks, enter the following information in the chat: your name, your organization, your coalition name and location, and any activities and or updates you'd like to make us aware of. Next slide, Mary. Okay, want to do a little pulse check with everybody, and in case there's any updates or anything else you're interested in letting us know about, how can Mountain Pacific Quality Health currently support you? And we'll be, as I said, going through some polling. And as we go through that polling today, we'd like you to identify the most important areas of focus in your community. As we go forward, we're going to be doing a little more recruiting in the work that we're doing. And as we recruit, we will be also looking at partnership agreements going forward. And so we'll be sharing that link with you today also. The coalition participation agreements will be only for the new members. And if there are anybody else additional or potential partners for recruitment that you wanted to report on, please let us know. And I'm putting the link for the participation agreement in chat right now. Our next all-member meeting will be January 24th, and that'll be 2023. So we'll get that out to you again in the month of January. Next slide, please. I'd like to give you kind of a high overview. We did have a modification, a mod 3. This is the third modification for this contract. In all the times that I've been working here, we've never had that many modifications, but as we're looking through it, we're looking at different categories of care, and under the categories, we have a number of subcategories. So with opioids, we're looking at different ways that we implement pain and opioid use best practices. We want to decrease opioid adverse drug events and in high-risk patients, and we want to also reduce deaths. For chronic disease management, we're looking to increase hypertension diagnoses and blood pressure control. Outpatient cardiac rehabilitation. We're trying to decrease A1Cs for Medicare beneficiaries and slow the progression of chronic kidney disease. Emergency preparedness plans. We are going to be polling questions about this today. We'd really like you folks let us know, yes or no, when we get to that poll, if you do have an emergency preparedness plan. And for immunizations, what we're looking for is to increase flu, pneumo, and COVID vaccinations in all of our coalition work. Next slide, Mary. So I want to go through some coalition updates a little bit, and we'd like to start with some of the new people that we have hired since our last meeting. So I'd like Jennifer Stewart, if you could come off mute and say hi to everybody.
Hi, everybody. I'm Jennifer. I am out of Wyoming and I will be doing coalition work throughout the state there.
Thank you. And Larissa Skinner, if you could say hi. No. No, Larissa?
I don't think Larissa is on.
Okay.
Hey, Mark. I just got in. Can you hear me?
Yes, we can hear you now.
Awesome. Sorry about that. My internet, I actually just got off the phone with a provider. They're not giving me the answer that I want. So I'm calling on my phone. You want me to introduce myself, Mark?
Yes, please, if you would, Larissa.
Awesome. So I joined Mountain Pacific in mid-August. I'm working on both sides of the spectrum, in the nursing home side as well as the coalition. And so I'm very happy to be here working with all of you guys. I come from a nursing home background. I was a social services director for about 6.5 years in a nursing home in Casper, Wyoming, where I still reside. I'm a social worker at heart, and my degree says the same. So let me know if you guys have any questions, and I look forward to working with you all.
Thanks, Larissa. I think I saw
Thank you.
Shaylin. Yeah, I think I saw Shaylin Trapton too. Is Shaylin on? No. Okay.
She is, Mark. I just don't think she can get herself unmuted.
Okay. All right. How about Kelly Perkins? Don't see them unmuted either. Okay. That's right. So we have a few other new people working with us in nursing homes, as well as the coalition work, which is the primary focus of our work going forward here. I'm seeing that Shay can't get off mute, so that's okay. I had some problems too this morning, Jay, all kinds of problems with my microphone and my speaker. So we'll work our way through there a little bit. We'll go through some general updates today. We're going to have a couple of presentations. Really excited about it. Updates on vaccinations, and we're also going to be looking at a project in Guam, working with the community health workers there. But I think what we'd like to do is look at our, take a look at really quick, kind of a snapshot of our data from our analytics team. So Liam, are you on today? No, Liam. How about Ray?
Yes, I'm on, Mark. Apologies, I don't know what Liam had planned to present today, but let's talk briefly about our metrics, how we track them. So as Mark alluded to, there has been a contract modification. They changed up some of the metrics we track. They still, of course, fall under those same categories that he outlined previously. So we've got metrics at the Partnership for Community Health, Read Community Coalition, and also nursing homes. We've been making that data available to our PCH and nursing home members. Apologies, I didn't know there was a presentation that was supposed to occur today, but what I can say is we're still early on in the metric process. We're currently getting ready to submit our 36-month remeasurement. So going forward, we've got approximately 2 years left to meet these metrics to, bring down our opioid ADEs, reduce admissions and readmissions. The other thing I'd like to say is if you have interest in any Medicare claims data, whether that's admissions and readmissions, chronic care management, diabetes, et cetera, reach out to your leader, really anybody at Mountain Pacific. Reach out to us, let us know. We're more than happy to help. That's part of our agreement with CMS is to provide some of this Medicare claims data to those who are interested. And so, yeah, that's all I've got, Mark.
Thank you, Ray. I appreciate it. Next slide, Mary. So we have our first polling question today. So care transitions are an important part of reducing overall harm and preventing readmissions. What activities or strategies have you implemented for improving coordination of care across settings? So please choose whichever of these that are most important to you, and we'll go from there. So it looks like post-discharge communication and contact for follow-up is the number one right now. Trying to figure out reasons for preventable or avoidable readmissions. Tiffany Calvetti is saying we use all 3 or 4 of these, B, C, D, and E. So far, we've got a response from 21 folks. Okay. All right, thank you all. Let's move on to our next slide, Mary. So we're really happy to have our pharmacist, Kyla Newland, here with us today, who's going to help us out with a little presentation on immunizations. So Kyla, if you're ready, go ahead and take it away.
Yeah, thanks, Mark. Thank you, everybody, for attending today. So just a few updates since the last time we met. Things have changed, of course, with the immunization recommendations for COVID vaccine. So just a few updates I'll go over. In August, we had our new vaccine approved, Novavax. It's of a different vaccine technology. It's a protein subunit vaccine. It's a 2-dose series given 3 weeks apart, an IM injection of 0.5 milliliters. And this is approved for those 12 and older. In addition to this vaccine, we've also had our bivalent boosters approved. So we can go to the next slide. So these bivalent boosters were approved, I believe, on September 2nd, if I recall correctly. And this is the most up-to-date information from the CDC here. These boosters are recommended for folks 5 and older. So pretty much a lot of our population. And that's if it's been at least 2 months since their last booster dose or from their primary series of vaccines, either the mRNA vaccines, the J&J vaccine, or the new Novavax vaccine. So the only folks that might want to delay getting this within that after that 2-month window are folks that have had COVID in the last 90 days, and they may wait 3 months after having COVID to go ahead and get this bivalent booster. So the bivalent booster includes about 50% of the original strain of coronavirus, and then 50% of the BA4 and BA5 components of the Omicron variant that we're seeing predominantly circulating at this time. So it does give higher immune response as far as antibody titer levels. And I encourage everyone to get a bivalent booster to be able to be best protected against COVID. And I will add one thing that has happened. You'll see the note on here that Novavax booster doses were recently updated. When the bivalent booster first came out, they said that you could not get Novavax as a booster. You had to get the bivalent booster. And they've now changed that, saying that if you received Novavax for primary series or received mRNA for primary series and for some reason cannot receive an mRNA vaccine because you either had a reaction or you have an allergy to one of the components, you can receive Novavax as your booster vaccine after that 2-month window from your last dose or your last booster dose. So that was a change we just saw last week. And I think I have the link to that. I can put it in chat. And we can go to the next slide. Okay, there's a link to that. So basically, the old boosters are no longer authorized now that we saw this new bivalent booster come out. I mentioned that 2-month time frame, and that it is 50-50 of the original variant and the BA4, BA5. Next slide. So this kind of simplifies the dosing process. So basically, you don't need to worry anymore about getting multiple boosters. No matter how many boosters you've had in the past, if it's been 2 months, go ahead and get the bivalent booster. So hopefully this simplified the booster process a little bit. And this is the schedule for those that are not moderately or severely immunocompromised, so just your general population. And then on the next slide, there's the recommendations for the immunocompromised folks. And these diagrams do not include that new recommendation for Novavax because it has not been posted yet. I looked today. So it doesn't have the recommendation that you can get the Novavax as your booster dose if for some reason you can't get one of the other vaccines. And we can go to the next slide. So a few updates on flu vaccine. There was one kind of a big change this year with the CDC recommendations. They do preferentially prefer one of these 3 vaccines for those who are 65 and older. They saw a slightly higher immune response when these vaccines were used. The high dose and then the recombinant and adjuvanted flu vaccines have been shown to have a little bit better immune response in this population. So if those are available, that would be ideal for those 65 and older. They also state if these are not available, they should go ahead and get any available vaccine versus not getting any vaccine at all, but these are preferred. Next slide, please. So this is just a list of all the available flu vaccines for this year. It has the dosing regimen, the age ranges, and there are quite a few products on the market this year. So it's a very nice chart. There is about 93% of our supply this year is egg-free. That's a question that's come up quite a bit. Oh no, that's the wrong statistic. 93% are preservative-free. And there are 2 products that are egg-free, completely egg-free. So if you have patients that applies to, then those are available. The only vaccines that have preservative in them are going to be the multi-dose vials. And they just have a trace amount. So not any concern, and there's no reason to be concerned about preservatives. But if you are, or if you have an allergy, then most of them are preservative-free. Next slide, please. So these are just a couple of the kind of social communications campaigns that are out there that I really liked the visual on if you want to distribute these or hang these up in your facilities or in your offices. These are really nice and they have a nice visual aspect to them to encourage folks to get their flu vaccines, including healthcare workers. We can go to the next slide. So this is something that's happening in Alaska, and I anticipate could be coming to some of the other states soon. It's an application called Docket, and you can actually, it's for patients to access their vaccine records. And it's an application that you can get on your phone or access online. So they just rolled this out in Alaska, I think about 3 weeks ago. So, and there's 5 states right now that are using this platform to allow patients to access their vaccine records. So keep your eye out for this. It's going to be a really cool tool, I think, to kind of have patients engage in keeping accurate immunization records and having easy access to that information. Next slide, please. And then I think I presented these last time, but just reinforcing the fact that there are some opportunities for continuing education to learn more about vaccine hesitancy and how to approach that with patients and communities. Next slide, please. And I think that's all I have. There's also the training, another training here from the CDC that you can also get CE credit for. And then just all the resources that I mentioned in my presentation. Any questions?
I have a question, Kyla.
Yeah.
Hi. I think I asked, so if I've had, as far as the COVID vaccines boosters, if I've always gotten the Pfizer vaccine, does it matter if I get Pfizer bivalent or Moderna or anybody?
That's a very good question. It doesn't matter which one you get. They say you can mix and match. So hypothetically, you could get the Pfizer, the Moderna, or the Novavax at this point, if for some reason you didn't want to get the mRNA vaccine for your bivalent booster.
Okay. And do any idea on duration? Does Pfizer last longer, or does it?
Yeah, so you know what we saw originally when we did the initial primary series is they were recommending that booster at 6 to 8 months. I think it was 8 months. So hypothetically, you know, depending on how the variants change, and it doesn't seem like they're mutating as fast as they were initially with these new ones. So I would say that 8 months would probably be hypothetically based on our previous experience, but we just don't know yet because we haven't had enough time.
Okay, good. Thank you.
Mm-hmm.
Any other questions? Thank you so much, Kyla. We really appreciate all the work you do for our communities. We're really excited today because we have our entire Guam team with us, who've been doing some really innovative work in navigating the course of diabetes self-care. So we have Agnes Glynis, and our special guest today is Gina Rojas. And we're really happy, Gina, that you are with us. She's also been a person who has been very significant in the Patient and Family Activity Council that we have in Guam. And they're going to be talking about a new CHW training program.
Hi, good morning and half a day, everyone. I'm going to share the screen if I could.
Yeah. There we go. We are actually very happy to tell you about the good things that are happening here on Guam. We are the Diabetes Foundation of Guam, and we are the newest resource for diabetes care. We're happy to join forces with the existing programs that are here, the Guam Diabetes Control Coalition, the Guam Diabetes Association, and of course, Mountain Pacific, to help us carry out our mission. We have just recently been formed, and we are focusing on these primary goals to provide education and resources, to engage our community, to support self-management programs for those living with diabetes.
We, of course, want to enlist healthcare providers, our diabetes educators, and our CHWs to help us improve the quality of life. And eventually, we want to start a diabetes data system, which does not exist on Guam. We've been talking about it for at least almost 10 years, maybe, to start a registry. So we're excited to start work with collecting and analyzing diabetes-specific data here. We have a great team with the foundation. You're familiar with some of them. Aggie, Glynis, myself, and we have Dr. Young, who is multifaceted in her talents. She is the Pacific Chronic Disease Council's consultant here on the island. And we are experts in these fields of diabetes self-management, chronic disease self-management, and tobacco intervention. So like I said, we're brand new. We were incorporated just this year in January of 2022. We developed our strategic plan and focused our mission and goals. We've already received our 501c3 status in July. And because of that, we went for it and applied for grant funding. And we are very blessed to have funding from two sources to help us launch two CHW training programs just this September. I'm going to talk to you a little bit more about how we're organizing these CHW programs. And just to give you a little bit of background, there really is no standard CHW program here on the island. It is a brand new workforce. There is another teaching organization that is providing a very thorough CHW training, but it's a very generic training. Our training focuses specifically on diabetes and chronic self-care. So we've done some research when we were organizing these programs and developing these programs, and we found that the C3 project was a really good base for what we were looking for in structuring our program. C3 is the Community Health Worker Core Consensus Project, and what they've done is developed core roles and core skills and competencies for CHWs. And they've also developed a list of qualities and characteristics that make up a good and effective community healthcare worker. And we're using that to help us in our recruitment. We're also applying the class standards, the national standards for including culturally and linguistically appropriate materials and teaching methods. And I think this is something that's that the Office of Minority Health is also promoting. So we wanted to make sure that we included that in our program. And we are doing that through using the Pacific Chronic Disease Council's Navigating the Course of Diabetes Self-Care as our core curriculum. The CHWs will actually have a certification as a Pacific Diabetes Care and Education Specialist once they've completed the 16-hour training and evaluation by our mentors. Our grant-funded programs that I mentioned earlier are specifically for CHW training in diabetes self-care. The Guam Economic Development Authority, through an incentive program with Guam Regional Medical City, it's a tax incentive program. So this year, we were one of 14 organizations to receive grant funding. And it's really helped us to launch our family-centered diabetes self-management education and support program. It's a two-part program where we train the community health worker in the Navigating the Course of Diabetes Self-Care curriculum. And then we kick off a 9-month program. It is family-centered, which means that the evidence shows that a DSMES program has many behavioral benefits. It fills a service gap here in Guam because we do not have a free DSMES program that's offered generally in the public and through public health. We have an opportunity to study the effectiveness of home-based family-centered interventions. And like I said earlier, we're going to be collecting data from those who are participating in the program. So what's unique to this program is that it is family-centered. So we are actually training the CHW who is a member of their family or clan. And we use the word clan here on Guam because we have extended family. We have a word called poksai, which means a person who is raised by another family, but not necessarily blood related. So we want to be sure that the unit learns together, that they're accountable for each other, and the CHW who is trained in diabetes self-management care is the lead in creating those good habits for that family unit. We were also fortunate to get grant funding through the CDC and the Department of Public Health for addressing COVID-19 and health disparities. That is the national CDC initiative. Here on Guam, 50% of the COVID deaths had a comorbidity with diabetes. Right now, as of 2020, which is our latest data, we know that 14.7% of our population has type 2 diabetes, and at least 3.8% are diagnosed with pre-diabetes. So we wanted to take advantage of the funding that was available to reach populations here on the island who don't necessarily have an understanding of the COVID vaccines, testing, and the complications with diabetes and other chronic diseases. So this is the first of their series in community healthcare worker training. We facilitated the 2-day training for 50 community healthcare workers who attended the 2-day training. We're asking that the CHWs form small group sessions using navigating the course of diabetes care as their core curriculum, and then launching a 6-month program in the small group settings where they have some familiarity with the members of that group. It can either be a cultural group, a corporation, it could be a neighborhood. We're not limiting their group origins. It is an incentivized program. The CHWs have a tiered incentive program for achieving certain benchmarks. And we found here on Guam that really works in delivering our programs to the community. The foundation supports the program by producing the supporting materials and the tools that the CHWs will need for recruiting their groups, for providing information in their small group settings once they start their programs. We have developed a private page on our foundation website, which is still a work in progress, but the resources will all be available on a private page that the CHWs can access whenever they need to. And then we are hosting monthly learning sessions for the CHWs for any topics that they'd like us to touch more on. We're calling them huddles. So if they have any issues or experiencing any difficulties or barriers in their groups, we have an opportunity to talk about it in a group setting with other CHWs. We created a title for our CHWs once they've completed all of their training and completed their programs. We consider them ambassadors of community health. So any CHW who completes the program, who has completed all the certification requirements, will be ambassadors for us. Because they are certified PDCES certifications, we would ask them to join us in public appearances or provide testimonials for us, participate in the coalition activities, and happily welcome them on the Foundation's Advisory Council, because we all, we need to have some guidance from other members as well. And that's a very exciting new thing that we're offering to the CHWs, and I think they're excited about it as well. And that's what's happening here on Guam. Very exciting. We're just launching the programs. November, we'll be starting the small group sessions with the CHWs. Right now, they're completing their HIPAA and PHI overview so that we have a good understanding of the confidentiality of the participants. And I also wanted to mention, Mark, earlier you said that one of the goals for the coalition initiative is to reduce A1C, which is objectives in both of our CHW programs, and we'll be tracking that data as well. Anyone have any questions?
Hi, I have a question.
Yes, ma'am.
How do you outreach to the potential patients? Are you going through the physicians or using their patient panels? How are you finding those patients?
For the first program that's family-centered, the CHWs who are interested in participating, right now the grant allows us to train up to 12 CHWs and 72 participants. So we're relying on the CHWs to recruit their own family members or individuals that they know who have diabetes, pre-diabetes, or who are at risk for diabetes. For the COVID-19 and health disparities grant CHWs, they are responsible for recruiting their own small groups. We're asking them to recruit up to 10 individuals to participate. 6 is a more manageable number, but the CDC is recommending that we at least try for 10 per small group. We're also asking them to use the materials that we're giving them to recruit through social media. We're recruiting on our website, and we're going to be doing a little bit more promotion here through non-traditional media, so that we can spread the word that the programs are happening. Thanks for asking the
I
question.
mean, like Facebook, that kind of a thing.
We do not have Facebook right now. We're doing everything internally. We have a team of 5. And so that is definitely on our list to start some additional social media promotion through Facebook and through Instagram. We're just not quite there yet.
Well, could I just add to that? Hi, I'm Agnes White. I'm with the Mountain Pacific staff on Guam, as well as with the Guam Diabetes Coalition, which the Diabetes Foundation of Guam is a part of. Some of the way we recruited is we found organizations in the community, ethnic organizations. There's many islands surrounding Guam, and they have their own organization, and they're very concerned about the rates of diabetes within their within their islands. It's very high in the Pacific, especially out here in the Micronesian islands around Guam. Diabetes rates are extremely high. We partner with the Pacific Chronic Disease Council, and that includes many of these islands. So we do have contact with some of the local organizations that help their islands, and they're very interested, and that's how we got some of our participants in our programs. So that's one way we do it. There's many different organizations like that on the island, and we tap those as well. And also clubs like the Lions Club, they're very active with us as well. And the Filipino Association, that's another group that can be tapped as well. And the Rotary Club has started, there's several chapters on the island. We've gone to some of their meetings. They've had us as guest speakers, and they're a good group to really network with.
All right, great. Thank you. Thank you, Agnes.
You're welcome.
So any other questions? Okay, thank you, Gina, Agnes, and Linus very much. Really interested in community health workers for one of the areas that you talked about. And I know that we are working with them in across our region here for Mountain Pacific, but the class standards, culturally and linguistically appropriate services is something that CMS is looking at now. And so I'm really pleased that you folks are working towards that. So thank you very much for your presentation today. Okay, so we have a few more polling questions we'd like to work with you on today. And the first one we'd like to put up is, do you have an emergency management plan? I have put a number of different resources. Oh, no, I haven't. Into the into the chat here. We'll try and get that out to everyone. All right. So it looks like about 67% of the folks. Okay, so it looks like 21 is the number today. This is a measure that CMS is looking at very seriously, and within the coalition partners, the measure that we're looking for is that everyone would have a management plan in place for this contract. Okay. Question number 3. We're happy to have had that community health worker presentation today. We're trying to figure out how health workers are impacting your communities. One is for navigating the health systems. The other is houseless outreach. Another one is access to appropriate care and medications. And D is referring to referring cases to community partners. And the other is care coordination. Care coordination is one of the ways we're working on it, particularly here in Hawaii with the houseless population that we have. We do quite a bit of care coordination and community outreach to find appropriate referrals to other services in the community. Health systems navigation has long been a real important look. Okay. All right. Next slide, Mary. What is your preferred method of receiving information? We're seeing a lot of changes in the amount of time people have to actually take part in different events. So what we're looking at here is email attachments, newsletters. B is webcast, C is short pre-recorded videos, D is podcast, E is panel discussion, and F is others. If you have other, please put it in chat. Well, email is running away with it here. Okay, thank you for your responses here. Okay, next slide, Mary. National Prescription Drug Take Back Day is October 29th. So these are from the DEA. You can find collection sites and resources with the link that's here. Take Back Day has been a very big program that's been going on, and we're really happy to support that how we go forward. And Mary has put that site in the chat also. We have a couple of more polling questions for you. Does your organization have a formal opioid stewardship program? Yes or no? Okay, 90% say no. Amber Rogers has put in chat that Mountain Pacific has Facebook ads running to promote the Take Back events. And if you'd like a customized community flyer, we can help with that too. All right. What resource assistance would be most useful to your organization as far as opioids are concerned? Naloxone staff training, education on pain assessment tools, awareness of e-kit components, pharmacy support on diversion prevention, implementation on establishing a pain committee, education on high-risk medications and reducing polypharmacy, adverse drug events, and others. And if so, please chat it in. Okay, more education on high-risk medication and reducing polypharmacy for adverse drug events. And then education on pain assessment tools. We are looking more at pain management now. Okay. All right, thank you very much. We have some events coming up from the participation in the It's Worth a Shot series. We see many of you on Wednesdays, meeting registration right inside here. On November 9th, we have a regional chronic disease collaborative education event focusing on team-based care. And you can also register for that event coming up. And our next quarterly regional coalition all-member call will be in January on the 24th. And you can also sign up for that one also. I've got a number of those links if you would like. Register for that meeting in January. And we'll put that into chat. The next slide, Mary. So do we have any questions today?
Hey, Mark, this is Shelley from Hilo.
Hi, Shelley.
Hi, good morning. I have a COVID question. I was wondering if anybody could share any hospital testing protocols regarding COVID and basically the prevention of hospital-acquired COVID. Does anybody have anything to share or Or, you know, is that a topic for other facilities?
Well, I think the medical staff wanted to review the options. They just wanted a separate meeting. They cannot attend.
Anybody have anything on COVID testing within the hospital? I guess not, Shelley.
Mark,
Okay,
I would
thank you.
say that we could probably be able to reach out to some of our folks and maybe, you know, forward that information as a request. If
Sure.
that's valuable for folks.
Yes, it would be very valuable. I would appreciate if you could do that for me.
Sure,
Absolutely.
Shelley. Yeah, I'm sure we could. Yeah,
Thank you.
yeah.
Hi, this is Tanya from Kauai. Do you mean COVID testing with staff members or with the patients?
Patients,
Oh, I see.
you know, are you testing everybody who comes through the ED? And then what happens to your, you know, your inpatient population? Are you testing them due to signs and symptoms?
Yeah. Yes, we test anyone that comes in through ED or psych or long-term care. And if they show any symptoms, we test. Also, if we have any nursing staff that tested positive, we test anyone that they gave direct care to.
What about if your patient has symptoms and then you test them? And when is your follow-up test for them?
We test them, I want to say day 1 we test, and then day 3, and then day 7.
Okay.
After day 7, we stop testing if they're negative.
Thank you for sharing.
No problem. We also, well, we've received through, I think it's the CDC and CMS guidelines. We kind of create our own little flow chart and disperse to our staff.
And we work with over 60 agencies on the federal and state level.
Can you guys hear me?
Here's what your department was using as a case management tracking system.
Yes.
Complaints or
Hey, Mark. So Larissa here. So earlier today we had a call with the Montana Infection Prevention Group. And maybe we can reach out to Marcy and see if she can get some guidance from them. But I think I kind of overheard some of the hospitals. They're also kind of looking for some guidance. But the people who spoke, they said they're testing upon, I think, admission and prior to discharge to make sure that they have a full turnaround. But Marcy might be able to give us some more connections on that.
Yeah, Tracy Larson also texted that employees, if they are symptomatic, unvaccinated employees test weekly. Anyone else?
Thank you.
Thank you, Shelley, for your question. Okay. Well, we're really grateful for your folks participating with us. Look forward to seeing you again next quarter. Our next regional meeting will be on Tuesday, January 24th, 10 a.m. American Samoa. It'll be 11 o'clock in Hawaii, 12 o'clock in Alaska, and 2 p.m. in Montana and Wyoming. Guam and Saipan will be at 7 a.m. the next day. Anybody else have any other questions?
Hey, Mark, I missed it. Sorry.
Yes.
What time is the meeting in Hawaii?
The meeting in Hawaii is 11 o'clock.
11. Okay.
So thank you all for being a part of this with us. We really, really appreciate the collaborative work that everyone is doing in a regional sort of perspective on the work we do and how we might be able to share that. So thank you very much.
Mark,
Yeah.
can I just announce real quickly about our meeting, the Honolulu Coalition meeting on November 30th?
Sure.
We have a special speaker, Dr. Jared Sugihara, and he's our nephrologist. And for those of you who are in Hawaii, they'll be talking about our Malama Kidney Clinic and their efforts to address chronic kidney disease in Hawaii. So it might be good information for you to chime in on.
Thank you, Anita. All right, aloha, everybody. Thank you.